This week, we're going to be dealing with therapies for all those psychological disorders that we talked about last week. And the first group of therapies in this first video are biomedical therapies. And obviously, the most common biomedical therapy is the use of drugs, the use of medications that work with the brain in trying to resolve the disorder. We also have brain stimulation, light therapy, which we'll just briefly talk about, but also electroconvulsive shock therapy, ECT. It's actually still being used today, but not very often. The one that is used more today is transcranial magnetic stimulation, which is non-invasive, unlike ECT. And then we'll talk about psychosurgery. So these are the biomedical therapies. And first, let's deal with medications. There are different medications depending upon what your disorder is. There are antipsychotic drugs that deal with schizophrenia. There are antidepressant drugs that deals with depression and mood disorders. There are anti-anxiety drugs that deal with anxiety disorders. And then we have mood-stabilizing drugs that deal with bipolar disorder. So let's look at each one of these. First, the antipsychotic drugs, things like Thorazine or Haldol, drugs that typically are taken by schizophrenics that have positive symptoms, hallucinations, delusions, and so forth. What it does is it blocks dopamine receptors. So it prevents dopamine from being released, and by doing that, it's successful in treating the positive symptoms of schizophrenia. Antipsychotic drugs. And it's very important that someone that's on an antipsychotic drug maintain that drug treatment. The second are antidepressant drugs, things in groups of these, that tricyclics. We've already talked about the MAO inhibitors, and then there's selective serotonin uptake inhibitors that really causes serotonin to stay in the system longer because the uptake into the presynaptic cell is blocked. And Prozac, which is probably one of the most common drugs given for depression, is one of these serotonin uptake inhibitors. It increases concentration of norepinephrine or serotonin, increases that concentration in the brain, and thus helps in reducing depression. Drug treatment for depression is considerably more effective than drug treatments for schizophrenia, the antipsychotic drugs. They work pretty well for most people. But remember the placebo effect. We're giving somebody a drug for their depression, and sometimes just having a placebo works just as well as having the drug itself. So you have to always be aware of using control groups and worrying about placebos. And second, depression often has spontaneous recovery. People just recover from the depressive episode without any treatment. So we don't know whether the drug caused the reduction in depression or whether they're experiencing spontaneous recovery. In testing the efficacy of drugs, then, we have to really worry about the control group and how the control group is used. The next is anti-anxiety drugs. These have a tranquilizing effect. They sort of calm us down, reduce the anxiety. Sometimes they really deal with muscle relaxants so that you feel more relaxed, because if your muscles are relaxed, you don't have the tension that is produced by anxiety. The problem is that these anti-anxiety drugs can be habit-forming, so they have to be used with care. Mood-stabilizing drugs, like lithium, that's the one that's prescribed most for bipolar disorder, is very effective in treating bipolar disorder. It works in 7 out of 10 patients. And the interesting thing is it reduces the risk of suicide because it does stabilize the depression and the mania. Now, the use of this drug, lithium, works well with bipolar disorder, but it doesn't work with the chronic depression disorder or major depressive disorder. So it shows that the depression in major depression is very different from the depression in bipolar disorder. Interesting, lithium is a naturally occurring element, and it occurs in drinking water. And there have been several studies that show that if the lithium is high in drinking water, you get a reduced rate of suicide. This occurred in 18 Japanese cities in a study that was done a few years ago by a Japanese scientist. It also worked in Texas, where they showed that in towns in Texas that had high lithium in the drinking water, they had fewer suicides, but also fewer violent, aggressive acts, convictions of things like murder and things like that. So some people have suggested that lithium be put in drinking water, just as fluoride is put in drinking water to help with prevent teeth decay, but so far that isn't done. It's just a naturally occurring element that occurs in drinking water. We don't know why it works, but it seems to work very well for bipolar disorder. Let's talk now about biomedical therapies. The first one I want to mention is light therapy. And light therapy actually is where you have seasonal depression. People in societies that have a lot of darkness, light therapy works pretty well in reducing the depression. It's simply being exposed for periods of time to high levels of artificial light. It works with seasonal depression where you have darkness which produces depression, or it works with, sometimes it works with jet lag, by the way, where you can actually force the body to go in sync by using this light therapy. But the one that used to be used a lot in the early days was electroconvulsive shock therapy, where you put somebody on a table and you apply heavy doses of shock to the brain, and that electric shock produces convulsions because of the brain being shocked, and those convulsions then are followed by periods of amnesia and sort of reduction of the really major depression that occurs. It's not used much anymore, and now if it is used, it's used when all the other treatments for depression don't seem to work, and now we use anesthesia so the person isn't just shocked when they're awake. And we use muscle relaxants so they don't break any bones when the convulsions occur. And they're shocked for about 30 or 60 seconds, and that's done several times a week for a few weeks, and it produces, in some people, this reduction in depression that we see. Like I said, 3 sessions each week for several weeks. It works, but of course it has side effects. Sometimes the amnesia stays longer than you would like it to stay. We know that the brain actually is changed by electroconvulsive shock therapy, and we don't quite know what that means. So it's not used now except in those rare cases where the depression really is debilitating and nothing else seems to work or help. One that is used now a lot is repetitive transcranial magnetic stimulation, which is non-invasive. It's just simply used as magnetic stimulation. It causes no seizures, it causes no pain, but it does have modest benefits, especially in stimulation of the frontal areas and treating disorders. And at our Georgia Tech Brain Imaging Center, we actually have the equipment for research purposes to look at transcranial magnetic stimulation. And the last biomedical therapy I want to mention is psychosurgery, where you go in and you cut off parts of the brain. It was very commonly used in the 1930s and 1940s and was abandoned in the 1950s. And what the surgeon would do is they take something like a ice pick and they go into the eye socket and simply swish up, sort of mess up the frontal lobes. It's called a frontal lobotomy. And 35,000 people had frontal lobotomies up into the early 1950s, including John Kennedy's sister. And when she had the frontal lobotomy, it really made her change dramatically. She sort of looked like she was a child in terms of her intelligence after that procedure. Now we use, using the MRI, where we can actually see a picture of the brain, we use MRI-guided precision surgery, where you go in and look at some place that you want that's causing a lesion or causing something like an epileptic seizure, and you can be very precise, and it's used, like as I mentioned, psychosurgery is used only in the last resort, when nothing else seems to work. So we look today at biomedical therapies, and next time we're going to look at psychological therapies. Thank you.